All right, we're just going to get our presentation pulled up. Okay, it's taking a second to load. All right, so this is group 14. We did shingles. As you can see here in this illustration, it's a depiction of what shingles could look like and how it could present on the body. Again, this is just an example of what you might see with a diagnosis of shingles. Okay, I am Jamie. I am covering the etiology today. So what causes you to have shingles? So the first cause of shingles, you kind of have to go back to childhood, to your adolescent period, maybe young adulthood, when you had chickenpox or you received a chickenpox vaccine. Chickenpox would present with small red dots of a rash, possibly fever, and some other presentations there. But as chickenpox goes away, you would see that the virus then moves to the dorsal root ganglion, and it will remain latent there. So it kind of takes a nap. It goes to sleep. It's hanging out in your body for the rest of your life. Then at some point, we don't know exactly what would reactivate this, but you see a reactivation of the virus, varicella zoster virus, VZV. Again, so this is the same exact virus. The first time you get it, it would be the chickenpox, and the second time you get it, it would be the shingles. The virus did lay sleeping in your body, and now you've been diagnosed with shingles. Just because you were diagnosed with chickenpox does not guarantee you that at one point in your life you will be diagnosed with shingles. You will develop this, or what we see develop this is shingles comes, and most of the time it's an older adult with a weakened immune system. So you're looking around the ages of 50 plus. They could be going through cancer treatments and things of that nature, anything to weaken their immune system, and then that could cause the reactivation of this virus, and then they would present with shingles.
Hi, my name is Morgan Frank, and I will be discussing the description, characteristics, and courses of the shingles virus. And shingles is caused by the varicella zoster virus, VZV, And the virus is capable of becoming inactive and stay within the immune system, but later in a few years could become active or reactivate. And there is no simple cause that explains why the virus reactivates itself, and it usually occurs in adults, generally around the age of 50 and above, and it is a painful and itchy rash that often comes up as a stripe of blisters that wrap around either the left or right side of your body, and this could be seen as lesions. And since this does involve active lesions, this could be transmitted to anyone that has not experienced chickenpox or has not gotten the vaccine or the varicella zoster virus. It is transmitted when there is direct contact with the active shingles lesions. And on the side of my page, I put a picture of the skin and what it would look like if the shingles lesions did develop on the skin. And so on the top, it is the very red lesions where they're filled with pus. And then the blue dots and the nerve fibers are the virus itself.
Okay, so this is Anastasia filling in for Hector, and he had incident rates and statistics, and roughly 1 out of 3 people will develop shingles in their life, and 10 to 15% of people who get shingles will experience post-therapeutic neuralgia, PHN. Incidents of developing shingles have gone up since the chickenpox vaccine. However, there's no correlation yet suspected since the rate has not increased since the beginning. And the graph that he has here just shows the shingles incidence per 1,000.
Okay, this is Courtney Monde, and I'm doing the diagnosis and treatment of shingles. So shingles is best diagnosed by a rash and pain on only one side of the person's body. These symptoms can be present along with a stinging, burning, or itching sensation of the skin. To distinguish this from any other form of dermatitis, there is typically also a fever, chills, and nausea. If these other symptoms are not present, then the doctor may take a tissue scraping along with a culture of the blisters and take them to the lab to examine. In the picture, it is showing once again where typically the rash occurs, which is right along the rib cage, and once again it is only on one side of the body. For the treatment for shingles, there is no cure for it, so the only thing doctors can do for shingles is help speed up the healing by prescribing an antiviral drug. And along with an antiviral drug, the doctors may prescribe something to help with pain, including lidocaine or local anesthetic. There are also home remedies options like a cold bath or a wet compress to help with the itching, but there is no cure.
Okay, it's Anastasia again with prognosis. So, after you receive treatment, the pain from the lesions can subside within 3 to 5 weeks, but once again, it's not going to be cured. It's only going to make the pain less itchy. People with weak immune systems are the ones that are most likely to get the shingles. So, an older person with cancer who's receiving chemotherapy is really likely to get shingles because of how weak their immune system is. A person that has shingles can also pass the virus to someone who hasn't had the chickenpox vaccine. But the other person that they pass the virus on to is actually going to get the chickenpox. They won't get the shingles. And then this last slide is our references, and our main references were from Mayo Clinic and the CDC, and we used multiple pages from both websites.
Thank you. Thank you.